Welcome back. This morning we're discussing the prevalence of prenatal vitamins. Joining us this morning from Gunderson Health System, Dr. Charles Schauberger. Dr. Schauberger, thanks for being here.
Thank you very much, Brittany and Dustin.
Now, what are the myths on prenatal vitamins? Some people hear you should be taking a lot of them, maybe a few, maybe none. What are we hearing?
Well, in general, it's been long recognized that the major source of vitamins should be food. This time of year, with all the fruits and vegetables available, really you should be able to get most of what you need by eating a good, healthy diet. There are two nutrients for which women usually have troubles getting enough. One is folic acid. We know that using 800 micrograms of folic acid every day can help to decrease some risks of some birth defects. And the other nutrient for which we make recommendations are prenatal iron. We know that iron is so poorly absorbed by our bodies that it's hard to get enough in our diets, and so some supplementation is necessary for majority of women.
Now, is this kind of I mean, it seems like common sense just to be eating more fruits and vegetables, to be eating healthier, get those vitamins naturally, as you said. Is this kind of a trend we're seeing with vitamins in general? Like we're hearing that maybe supplements aren't as effective as we may have once thought they were.
Yeah, I agree with you. I think that we're sort of seeing a trend towards looking at the dietary components as being much more important, and supplements are seen by many people to be insurance against a bad diet, but we really should concentrate on improving our diets and only supplementing when you need to, or in those areas in which we can't get enough.
How do we know what we need to supplement? Are there signs or symptoms that we might be deficient in certain areas?
That's pretty rare that we see people with vitamin deficiencies to the degree that symptoms occur, and so really there really isn't a good way to test that. We certainly recognize that people need to be getting enough calcium in their diet and vitamin D, so patients that are lactose intolerant or have lactose intolerance or difficulty in drinking milk may find it difficult to get the amount of calcium they need. But in general, you aren't going to notice significant symptoms when you're not getting enough vitamins.
So we're running out of time here. Real quick though, the recommendations for pregnant women, it's still recommended to take folic acid and was it iron as well?
We generally urge women to consider iron supplementation. We usually test them at the beginning of the pregnancy and again at around 28 weeks to make sure that their blood counts aren't suffering terribly. But those are the two primary vitamins that we do recommend supplementation with.
All right, Dr. Schauberger, thanks so much for joining us this morning. We appreciate it.
Thank you.
And we'll head to break with a look at what's coming up on Good Morning America.